You're watching OnFire-TV.com, featuring news, interviews, and entertainment. Broadcasting from Radio On Fire Studios in Baltimore, Maryland, here's your host, Diamond K.
Welcome back. You man, Diamond K in here, of course. The Diamond K Show, OnFire-TV.com, at the Diamond K Show on all social media. So it's the end of the year. And, we always like to bring information that is helpful to our listeners. Now, of course, we have viewers from across the country, but I really want to focus on Maryland today. I'm going to focus on Maryland, and I want to talk about health coverage and the work that is done at Healthcare Access Maryland in Baltimore. So I needed to bring on an expert because, of course, I am knowledgeable about all things, but I'm not an expert in this field. So I have an expert with me. How's it going?
Hey, what's up, man? How you doing, man?
Oh, can't complain. So please introduce yourself.
Well, my name is Luis Bordon, and I'm a bilingual healthcare navigator for Healthcare Access Maryland here in downtown Baltimore.
All right. So let's talk a little bit about what you do, right? So obviously, Healthcare Access Maryland helps folks get access to healthcare and health coverage, and help residents navigate and find the insurance that they need. So you are a certified navigator, true?
Yep. That's pretty much my job.
So what exactly does a navigator do?
So navigator, basically, we do get certified. What we do is through the website, through Maryland Health Connection, we help everybody in the state of Maryland enroll in healthcare coverage. A lot of people do get confused when they do it themselves. So that's why, we get, that's why we get certified. And we get paid to do this, to help everybody in Maryland get insured. So I do majority of I was located in Howard County. They keep spreading us around throughout the Maryland area. And right now I'm still working from home. I'm hybrid, but I am located in Baltimore too. They send me to different places. So.
Right. And then so you said that a lot of times folks can get, confused on the website. So you can walk them through this process. They can call you on the phone and you can walk them through that process.
Yeah. So, when we used to work in the office, a lot of people would come in person, but now that we're working hybrid, that's why I see that the numbers right here at the bottom, the 410-500-4710 number. So everybody that calls that makes an appointment. Once we get an appointment with them, we give them a call and we'll go over that. If they're a brand new application, we'll help them start the application from the beginning. We'll go from step one all the way until the end to see whatever they qualify for, which it could be Medicaid, which is the free state insurance, or the QHP, which is the qualified health plan that's open right now, which is started in November 1st all the way until January 15th.
Now, I think that part may confuse folks. So there is a difference depending on income.
Yeah.
So January 15th, last chance for them to enroll for 2023 health plan. And that is with the Maryland Health Connection.
Maryland Health Connection, yeah.
So what would be the difference between what the Maryland Health Connection does and say just regular coverage, regular Medicaid?
So it's everything is done through one application. So it's one application, two different programs in there, right? So everything is based on eligibility, income, and you have to meet certain requirements. For instance, in the state of Maryland, you do have to be a U.S. citizen or a green card holder for more than 5 years in order to qualify for the free state Medicaid. And everything goes by household size too. So if it's a household size of 1, then there's a cutoff number. I believe the correct number, I think, is somewhere. It went up. It goes up each year. So I think for one person household, as long as you don't make more than 1,564, you should qualify for Medicaid. And then once you're over income, it all depends what time of the year. For right now, you do qualify to enroll in the private plan, which a lot of people call Obamacare. We just call it QHP, the Qualified Health Plan. And that's where the open enrollment comes in. So we look at the income, what you're going to make in a year. If you don't qualify for the free state insurance, then you'll qualify for the private insurance, which you get to pay. It all depends how you use your insurance. We ask a lot of questions. Do you go to doctors on a regular basis? And then we try to look at plans that's more convenient for every consumer in the state of Maryland.
Right. So you were talking about folks have the opportunity to be helped virtually, and call on the phone. But what if it's somebody that's old school, is they classic, and they don't do the phone thing like that, and they want to come and talk to someone in person? Is that something? Is that something that can happen?
That's a good question, man, because now we're actually going back to the offices. So we do have some in-person location. As a matter of fact, one of our main locations at 1 North right now. 1 North, let me get the address. I know I have the address. 1 North Charles Street, yes.
1 North Charles Street.
And that's where they can go in person. We do have places at the Baltimore County Health Department in Drum Castle. Depending on where people live at, we do have Frederick County Health Department. We have the Anne Arundel Health Department too. Shepherd's Clinic, that's based on appointment only. The Esperanza Center, another appointment-based multi-service in Laurel, that's a walk-in place. So we do have places where people can go in person.
Right, that's good. So
and we do get a lot of people that actually want to do person. They don't do the whole phone thing because especially when you want to bring pay stubs, as a bilingual person, we do get a lot of from the Latino community. They say, hey man, I don't know how to even send a pay stubs because everything's based on income. So when the system asks for proof of income, they don't know how. Sometimes they don't even know how to send emails, faxes, or when I tell them take a picture of your pay stubs, they don't even know how to do that. So it's a good thing that we do have the walk-in site.
Absolutely. You want to make it easy. You want to make it convenient for them. So let's talk about this process. So they complete the application, whether it's in person with a navigator or whether it's over the phone. And then what happens? Do they have coverage right then?
So if they apply for Medicaid, right? If they do qualify for Medicaid, let's say at the end of a person comes in, they're not working, they're working part-time, they're making maybe $1,000 a month. Let's just throw some random number. At the end of the application is going to give them a determination, which is this person such and such qualifies for Medicaid. And let's say right now, if you were to apply for health insurance and you qualify for Medicaid backdates to the beginning of the month. So if you have if you had anything, if you went to the hospital 2 weeks ago or something like that, you weren't covered, Medicaid will cover that. Now, my job as a navigator, I can tell you what you qualify for, right? There is a process where you have to select an MCO, which is the managed care organization. Mm-hmm. And that we usually do, the eligibility workers do that part. I don't do that as a navigator, but we do refer them to them. We don't just tell them, hey, you're on your own now, wait for Medicaid.
Go do you. Right.
But we do tell them it is a process. So it is, even though we do tell you do qualify for Medicaid, it could take up to 30 days. Usually sometimes it's less than that, but we tell people up to 30 days because by the time, especially if you're new to the system, by the time the system gives you a Medicaid number, they send you the red and white card first. Then if you choose an MCO with an eligibility worker or by calling Maryland Health Connection or by you doing it on your own application, if you have your username and password, there's an option there to choose an MCO. Then let's say, for example, if you choose a Mary Group Priority Partners, there's a different date with that where your coverage will begin. But all of that, it could take, we usually tell everybody up to 30 days and they should be able to get that from there.
Right. So let's talk a little bit about special enrollment. What are there some life-changing events that happen outside of the enrollment period? Are they just SOL? What can they do?
Nah, we can't do that. So it depends. That's a tough word to tell. We can't tell consumers that. But
right, but let's say they get married or they get divorced or they have a child or something like that.
So there's plenty of life changes. There's changes by you even losing coverage. Let's say for some reason you you go from full time, or you just get your job says, hey, we're cutting the position, we're no longer as of January 31st, you're out of a job, right? So then they have 60 days from that time when they get let go. So let's just use December 31st. If my job tells me right now December 31st, my last day, and open enrollment ends on January 15th, I technically don't have until January 15th. I actually have the whole 60 days so I probably January 31st, prior to before February 28th to select a plan. But in those cases, we usually tell people, don't wait for the 60 days. We want you to get covered because, we want to protect people from the unexpected, man. Because, we want to get everybody insured. With all the different things that are coming up, the different COVID variants, we want everybody to be covered. So don't wait the whole 60 days. Come over, call the number, and we'll help you out. But as far as the special enrollments, like you were saying, there's different ones. Immigration status, if you're first time coming in into this country, that's a life event. Getting married, having a kid, moving from a different state. Let's say, what else? I know there's like bunch of other ones. I know if you losing coverage, we already talked about that. And if you're incarcerated
too, losing a dependent, right?
Yeah, if you're also once you turn 26, that's also another one. You could be losing coverage. Some places with Maryland Health Connection, if you have an account, you turn 26, they're not going to kick you out if you're under your parents. You wait until the following open enrollment. They're not going to tell you, hey, you're on your own. It could be July and say you turn 26, you're out. No, Maryland Health Connection will let you finish the year, and then you can create your own plan or get the employer coverage. Now, it's different coming from the employer because sometimes once you turn 26, they're not going to cover you till the end of the year.
Yeah, so it's but like you said, it's a lot of different things, and so it's good to have someone who is certified in this and can help you through that process.
Yeah, man, we try to tell people that. I mean, that's what we're here for, man. I see different cases all the time, and people want to do some things on their own, and then they get a huge bill, and then they come to us. Sometimes when they get a huge bill, and then we fix the cases, it's kind of tougher on us to help them with the billing because they're already signed up. Let's say, for example, one of the questions that Maryland Health Connection asks in the first, it's probably like one of the first ones, as soon as you create your user ID and your password, is does anybody in the household want to apply for subsidies? And that is, a lot of people don't know what that is. The subsidies is basically, if you put yes, if they're going to qualify, it's like I said, this program's based on income. So if you click no, you ain't going to qualify for nothing. So you're going to get everything at full price. Even if you're not working, they're still going to give you full price health insurance. It's like with no subsidies at all. Once you click yes, then they're going to determine, okay, this person's not working, so it'll be either Medicaid or they'll give you subsidies for your monthly premium to be lowered.
Yeah, and that kind of stuff can really get confusing to folks that just don't know. You know what I'm saying?
It is, man. You'd be surprised how many times I see applications where they say, hey, I don't know what's going on, but I don't have a job, and there's no way I can pay $470 a month. There's something wrong. The first thing I look when I look at the application is that they put no for the subsidy question, and that's automatically just makes the application easier. That just takes you straight to the plans.
So y'all can help folks with that kind of stuff. January 15th is the deadline for 2023. So
and don't wait until the last second.
You definitely
want to do it now. Do it now, because them phone calls, people are going to start calling January 14th. Can I be seen the next day? Sometimes, especially the ones that are working from home, sometimes those appointments can be busy. Or, if you go to a walk-in location, you're going to be waiting there for a while. Because even though it's good that you're coming in to get enrolled, we usually tell people not to do it at the last second. And I'm like that too. I do things at the last second, but so I can't blame.
Yeah. So, but they got time to get it done, and no time like the present. So let's look at this. So just want folks to see how simple it is. You can go to MarylandHealthConnection.gov, and so for folks that speak English, or if Spanish is your primary language, you can do that.
Different languages
we have
there too.
A wide variety of language options to cover whatever language you're most comfortable with. And as you can see, the site is pretty straightforward. They can create an account. They can sign in if they already have an account.
There's an estimate thing too. If you see it right next to create an account, a lot of people, especially self-employed people, don't really know. I don't want to get health insurance. It might be too expensive. We usually tell people, anybody, not just self-employed, it's just anybody who's coming into the system. Go look, man. It's simple. You see that? You put the zip code, the county, the age, anybody else in the household, add them, and then once you put the income, you could put like 30,000 for one person. It's going to give you estimates on how much subsidies you're going to get and how much health insurance. How much your health insurance will be starting in January.
Yeah, that's good. And sometimes folks want to do that just to get an idea, just to get an idea. But there's so much valuable information here at MarylandHealthConnection.gov. And if folks wanted to start creating an account, they could do that. Now, say they start creating the account, but it gets stuck, right?
That's what we
stuck somewhere in the process.
We come in and finish it for them. So now, before it was a little easier to create an account. Now it's mandatory that everybody has an email address because now the system is verifying. So they'll send a code to your email. And some folks don't have email, so sometimes we either have to help them create an email or just use, somebody like a parent or some of their child that might have access to an email so they can get the code. And just like you said, the old school people, then some people don't have email, so right. it's kind of hard for us to start an account. And it's for security reasons. I guess they're doing it now, but it's actually, if somebody gets stuck, even though they haven't really created an account, that's where we come in and we actually do it for them and actually, ask for the email, whatever they can. We give them all the information so they can have at the end their username, ID, and password. But we tell them, please do not touch unless you really know what you're doing, because that can mess up your insurance going forward.
Absolutely. And of course, the application, it says, is available daily from 5 a.m. to 1 a.m. So that means that any time they can go on and start working on it themselves.
They can go in. They can download even the app on the phone. I have it on. Sometimes, of course, one of the pet peeve. Well, it's not really a pet peeve. I enjoy doing this, but sometimes when you're at, this guy does health insurance, man. Holler at him. Do something. He'll hook you up. I can't really do anything when I'm outside, but I can tell him, listen, if you're not getting offered health insurance at work, you can just download the application. I can help you run through it, give you an estimate. A lot of people think, oh, Luis, that's the health insurance guy. But once, there's personal questions they ask. They ask questions about your income. Some people don't really want to be too open about your income. And I tell them, listen, I'm only going to tell you, I'm going to be straightforward. If you want me to really help you, especially, if it's a friend or something, or just somebody who needs coverage, I'll give them the number or just tell them how to do the over the phone, downloading the app, and you can even do an estimate yourself, put your income, and they'll give you a determination right there.
Yeah. So I didn't even think about that. So folks just come up to you like, I heard you do the coverage and help me out, and you off work and everything.
Man, I'm gonna tell you, man. Sometimes when you've been doing this I've been at HCAM for going on 5 years already, but before that, friends like, hey, my friend, I was like, he needs health insurance. Can you help him out? It's like, man, I can only do but so much. You can tell him, call me when I'm at work, make an appointment. But yeah, it has this, pros and cons. You actually do help, people that actually need. Some people don't know about Maryland Health Connection. You'd be surprised how many people do not know about Maryland Health Connection. Oh man, I could have had insurance this whole time. Nobody told me about this. A lot of people who are not working, they just probably live on their parents who might have, they're blessed with a lot of money, but they didn't know, they don't have health insurance, but they know that even though they're staying with their parents, they're over 26, they're not working, they're still qualified for Medicaid.
Absolutely. And that is like valuable information. And to your point, a lot of people just don't know. So if you are living in Maryland or so what if someone is coming to Maryland? Like maybe they're coming to Maryland next week, right? Could they apply now? How does that process work?
They can sign up. Now, if they don't have any service, like for instance, the system has gotten smart enough, right? Where if let's say me and my kids moved from Tennessee to Maryland, right? And I had Medicaid in Tennessee, and I just didn't call to cancel. I can still enroll, right? But the system is going to give me an alert saying, hey, such and such, you and your kids have insurance in another state. So they're probably providing information for you to call, the state of Tennessee and try to cancel your insurance. But anybody who comes into the state, anybody, Maryland, as long as they have, the proper documents and everything to sign up, everybody should be good. And remember, they're coming in from a different state. So technically they have within 60 days, especially if I'm coming here for a job where they're going to pay me good, but my insurance doesn't start for another 3 months or something like that. I can still get covered because, I'm still doing open enrollment. I do have the qualifying life event, and then we can just go from there.
Yeah, that's really good. And I love the fact that it's so easy. So there's no any barriers, language barriers. That's not a problem. That can be addressed. If someone, like I said, some of our classic folks that like still got CDs and all that, they may want to be in person, right? They may want to be in person. They don't want to stream their music.
Man,
no,
CDs,
they want a CD, and they want to come in person, and that's all good. They have a lot of different options. Again, the website is MarylandHealthConnection.gov. You have until January 15th, and 410-500-4710. So this kind of work has got to give you a good warm feeling because you're helping people.
Oh yeah, man. You'd be surprised how many times, working since COVID started, but now you get it over the phone. Somebody might call you back 2 weeks after you help them enroll, and I'm like, I don't save everybody's number because once they call me on my work cell phone, I just see so many phone calls, so I can't save every consumer. And we get some random, hey, I just want to call you and say, God bless you, thank you so much. You don't understand. It's like, now I can have, get ready for the surgery, or just it's a blessing. It's a blessing. And even when I was working in the office, people will come back and thank you. And even if they see you at the mall or something, hey, you helped me out, and they said thank you. Can't really ask them for it. Discount whatever store they have, but
yeah, that is real good. That is real good. And like I said, very important work. Folks need to get protected from the unexpected. That's what it says at MarylandHealthConnection.gov. Enroll in a health plan by January 15th. You got a bunch of navigators that are ready to help. Just like you said, don't wait until the 15th. Let's get this done.
And just like you said, it's not just, we got, even though we got English, bilingual, Spanish speaking, somebody comes here don't have, Europe or different country, different language. We don't have, we have language line, man. There's no excuse. We helping people out. We're not turning nobody down. We're not turning nobody down because they don't speak English or Spanish. We got that language line that's going to help them get enrolled.
Absolutely. Absolutely. We got this language thing on lock. Thank you so much for chopping up with me and talking about this very important thing. Anything you want to say before we get out of here?
Yeah, no, man. I just say, hey, thank you for having me here, man. And just to let everybody know, even though I kind of repeated myself, don't wait to the last second and get covered. You guys do not understand the importance, especially as young folks too. Well, I'm not that young, but young folks who are, into sports, anything can happen. You're going in, you get crossed up, or you're going for a rebound, you land wrong. Them bills are going to come in. Once you go to the ER and you start seeing the bills, that's how people get back credit. So get enrolled. That's all.
Absolutely. The emergency room is not health coverage.
Nope.
Like going to the emergency, because I know some people that's like that, and they just, something happened to me, I'm just gonna go to the emergency room. That's a bill that's gonna come with that.
That's bills, and from different departments too. It's gonna be everybody in that ER, whoever's there from a different department. You're gonna get a bill from each department. Not a good thing.
Not at
get
all.
Covered.
Not at all. Get covered. Get protected from the unexpected. Enroll in a health plan by January 15th. MarylandHealthConnection.gov. MarylandHealthConnection.gov.
410-500-4710.
Absolutely. Thank you so much.
Yeah, man.
Really, really appreciate it. And
thanks for having me, man.
Real easy for folks to just hit that website, tap in, Call the number. Make it happen.
And don't be afraid too. Don't be afraid. We get a lot of people. I mean, I can speak, the Latino community, they think, just because somebody wasn't born here, we don't count the people. We don't report anybody to no authorities. We don't.
Yeah, that's important. That's important to say.
We tell people, regardless of what your status is, we're not going to report that. It could be, me and my wife, we don't have a green card. We don't have anything. We're just illegal in this country, but our kids are U.S. citizens. I'm going to put my information. It's going to be me, the head of household, my wife, and then my 3 kids who are U.S. citizens. They're going to get covered, but they're not going to report me to, immigrations or something because I don't have the Social Security or just status here. So we're not reporting to anybody, but we encourage every family member to do it. As long, and that's one thing I think I forgot to mention. We try not to put everybody in the household because as long as you're claiming, whoever you're claiming on your taxes, that's what we want to put. We can't put, I can't put my aunt, my uncle because they stay in my house.
Right.
We put immediate families only. That's one thing I forgot to ask, but don't be afraid to get covered. Do not be afraid. We're not reporting nobody to authorities. We're not reporting anything to any other agencies. We're trying to get people covered.
Right. The eligible folks covered. And let's dive into that a little bit more. All right. So if you have dependents that were born here, but you do not have a green card, it is still okay for folks to apply for their children.
Yes.
Now, obviously, they have to the parents, the head of household, have to be on the application, but they don't have to apply for themselves. Because
they just put no for them. They won't qualify for anything, but the kids will definitely. Because we see a lot of kids are not covered and they're born here, and it's like, why are you not? Why you don't have health insurance? Oh, because the situation. We try to educate them. We try not to get into the whole legal side. We tell them, listen, you're born here. You're going to get covered. We're not going to report your parents or anything like that. We try to tell them exactly, how Maryland Health Connection works.
Because the kids are eligible. The kids are eligible, and it is better for them to have that coverage than not. So
no coverage.
We got to get that out there more. Definitely.
Yeah.
Definitely. All right. Anything else we need to cover?
Yeah, that's it. January 15th, and the year's almost over. So y'all got about 16, 17 days.
yeah. Time is running out.
The first we don't work, the second. So you got less than that. So you got about 15 days if you count.
Yep. MarylandHealthConnection.gov. MarylandHealthConnection.gov. Get covered if you are in Maryland and you don't have coverage. It's like it's mandatory. You need coverage. Stuff happens.
You need it, especially now with all these different variants, man. You don't know what's going on, man.
And that's a whole nother level. The whole COVID variant, that's a whole nother level. Another reason on top of the many that you already have to get coverage.
Exactly.
All right. So MarylandHealthConnection.gov, MarylandHealthConnection.gov, enroll.
Call that number 410-500-4710. Make that appointment.
Absolutely. Thanks again.
All right, brother.
All right.
See you, man.
All right.
All right.
Mm-hmm. All right. So we had some valuable information here today, folks. MarylandHealthConnection.gov, 410-500-4710, 410-500-4710. Very easy to get coverage if you need it. All right. So let's do this. Let's take a quick break.